when you are in better shape, your body responds faster. Your resource management is more available, more ready, more willing to comply. When you are deconditioned,
it's rough.
You have less resources to fall back on.
Get in, losers. We're going lifting.
Welcome to the Dangerous Woman Podcast. I'm your host, Colleen.
No.
There you go.
Welcome back to the show. I am your host, Colleen Conlon, and this is Tim Facciola. Today is going to be an interesting conversation, a conversation that I think you will find interesting. I want to talk with Tim about some of our experiences in terms of people who have a currency. The currency is strength. The currency is muscle before going into situations that are inevitable in life, be it getting ready to birth a child or getting ready to go into some type of a surgical procedure that we know is going to happen. And then, of course, you know, there are going to be moments where life just happens. And sometimes, you know, you have to go under the knife, whether it is scheduled or not. So does this like spark any stories right off the bat for you? Or are you just kind of like, where are we going with this? What? She didn't tell me.
Stories? I don't know about stories, but like there's it's part of life. It's part of what I do. It's definitely
part of what I do too.
Well,
it's not
the
just
way you frame the question. So for me, the first thing that comes up, right? What is BMI? What is BMI?
Body mass index?
Yeah.
Yeah.
What is it for?
What is it for?
Mm-hmm.
Judgment.
Not wrong. What is it for?
It's to help us understand a metric of the body. Everybody's laughing right now.
I'm on mortality rates.
Okay.
Did you know that?
Is that why everybody's laughing?
No one's laughing. Cue the laugh track. So it's based on mortality. It's based on mortality rates. So because BMI is a basis of your survivability at certain height to weight ratios, right?
Okay.
If this data was compiled to see in this X number of, big population studies, who's more likely to be healthy enough to endure this outcome. And like when we say BMI doesn't really matter, it does and it doesn't.
There's nuance to it.
There's nuance to it. So is it the best metric for determining someone's health?
No.
No, not at all. Especially there's plenty of, especially in bodybuilding communities where people have tremendously high amounts of muscle and very low percentages of body fat.
Chris is my brother-in-law, and Chris would look like he's about to.
Yeah, he would probably
die.
be classified as obese, but he's very much not.
Yeah.
So there's just, but my point of bringing up BMI and talking about are you prepared for what life's about to throw at you? When we are fit, when we are healthy, we are more reactive, more resilient, more able to deal with external circumstances that are outside of our control. Sometimes they're foreseeable, other times they're not. So, you mentioned pregnancy, you mentioned a surgery, you mentioned planned or otherwise, some elective surgeries, you schedule it beforehand, and then others are this is an emergency. But either way, when the currency that you mentioned that we have to deal with is our body composition, it is a big component to quite literally your survival rate.
Yeah.
So if people know what we'll pick a scenario. Which one do you want to go through first?
Let's use that situation. You had a client who had to have multiple planned surgeries again and again because of, I'm trying to remember what exactly her diagnosis.
She was diabetic.
Yeah, but not everybody with diabetes.
Yeah,
is
no,
like,
no, it was very extreme.
It was a very
she had
special
a
situation.
internal pump. So they literally, like, most people with, type 1 diabetes, they have an external pump. She had an internal pump. So it was literally inside of her body. And they would need to, every time this pump needed to be changed, because like it wasn't something that lasted. Anytime it needed to be reset or moved or whatever, what have you, they'd have to go in, cut it out, swap it out. Like, it was a pretty invasive procedure. So, and this would happen every couple of years. So, or, if there was a situation well before that.
Yeah.
So and it's like in the abdomen. So like we're talking about, one of the most important areas of the body. Anything that's like that close to your organs, your body's going to prioritize. It's going to be a pretty big indicator of your ability to move, your success levels. Anyway, so like she had knew, okay, I need to have another one of these surgeries. And she'd had several before already. And she came to me being like, I want to just get in as good a shape as possible before needing this surgery, knowing that like I'm going to be out of commission for like the next, 6 to 8 weeks. I was like, yeah, absolutely. So we, because like, you have this thing, this foreign body in your body. You have to, it changes everything in terms of contraindications, what you can and can't do. So we found a bunch of things that like she could do. They were definitely not conventional, and they definitely weren't, what you'd find on, the gym floor. You certainly wasn't a group fitness type of thing. And it wasn't even necessarily high intensity, but like for someone who literally could not exercise without creating, more risk than reward, just being able to move safely was enough to increase the literal tissue quality, like the tensile strength of her tissues. So I think we worked for like 6 weeks or so before. So like, we're not talking a tremendous amount of time prior to this first surgery, but in doing so, these were surgeons that she knew on a first name basis, because like how many times she'd seen them.
You got to do it so many times.
And they were like, what are you doing differently?
And she was probably like, what are you talking about?
And like, well, I've been doing this and this. And they're like, we can see a difference.
That's amazing.
Because that's pre-surgery. But when talking to her after surgery,
okay,
normally she's like, I'm going to be out of commission for, 8 weeks. The first time it was 4 weeks. The next time it was only 3 weeks. And so it's like when you are in better shape, your body responds faster. Your resource management is more available, more ready, more willing to comply. When you are deconditioned,
it's rough.
You have less resources to fall back on.
I mean, I can even talk from my own experience. I've had 4 abdominal surgeries, and the first one was done laparoscopically. And at the time, I wasn't strength training. I was a cardio queen, so I was moving to some extent. But I recently had a client who told me that she needed a laparoscopic procedure done on her abdomen. And I'm just thinking to myself, oh my gosh, this is going to be really rough. Meanwhile, she's been training a hardstyle kettlebell technique for over 2 years at this point. She bounced back so quick. And I remember just asking her, like, how are you doing? How are you feeling? What's going on? And she's like, I'm fine. Like, load me back up with the heavy stuff, coach. And I'm just like, I have to remind myself, when I've gone through that stuff, I was at a point in time where I was super deconditioned. I didn't strength train.
Well, and even beyond that, at that time, like you had an eating disorder.
Yeah. I mean, there are so many things, but like this client of mine, she's somebody who happens to work with Hillary Irvin, registered dietitian. And we're like laughing at that because I seem to bring Hillary's name up a lot. I didn't realize it. But you have to almost remind yourself, like, this person is not going to nobody's going to respond the same way as you do after a procedure because it's such a unique experience. But I was amazed with how quickly her bounce back was, because when I had experienced it, it was not like that at all.
Yeah. And there are expectations, right? The surgeons have expectations when they do a procedure. Like, this is what it should be. This is what the normative data suggests your recovery will look like. And yeah, there's outliers on both ends of that bell curve. But as it relates to giving yourself the best possible chances relative to that normative data, you don't want to be in the bottom half. You don't want to be in the bottom half of your health and wellness going into it, because not only it makes it easier for the surgeon's words, not mine. When this particular client had healthier, stronger, leaner tissues. 1, 2, she bounced back faster, which meant she was able to return to training much quicker than prior. So think about the traumas, right, of that overcoming, and then that inability to, like, the recovery time that needed. All of that whole window gets shrunken down. The body becomes more adaptive, more resilient, more able to respond, able to keep going. And that's really what we want. Now, with, a more fresh case, woman, freak accident, ACL, tears ACL, right? But like, she's been very active and has had a tremendous amount, like, great body composition, worked really hard for that.
Worked so hard, so strong.
And so I don't want to say botched, because I don't think that's fair, but the surgery didn't go as planned, right? So the recovery window gets pushed. And if that happens to a deconditioned person,
it's sad.
You don't want to imagine how bad it can get.
Yeah.
But she already, and we talked about this previously, of mindset and the practice and the discipline. So when it first happened, she was like, what do I do to mitigate my losses even before the surgery? Like, what can I start doing today? Yeah. Like, she just fell down the stairs. You know what I mean? And having that practice, having that mindset of what can I do now? And I was like, that's the best attitude you can have. And so, if she didn't have that from a mental standpoint, if she didn't have that baseline from a physical standpoint, the fact that this, long recovery, an ACL is, generally speaking, already a long recovery. We're talking about
how long?
6 to 9 months at a minimum.
Yeah, that's a long time.
And then, like, if depending on the activity of, like, return to play, what does that look like? It can be a year. And, even at a professional level, like in the NFL, if a guy tears their ACL, it's usually not like, they might be back playing the next year, like, a full year, and they're back, but like, they're not necessarily who they were pre-injury. Sometimes that bounce back is 2 full years. So, like, these are people, obviously, like, when we're talking about professional athletes, we're talking about the 1% of 1% of the, the physical specimen that is human conditioning, right? So if you are deconditioned, imagine what that becomes. Now, granted, what you're using it for is not necessarily jump cutting and trying to, evade 280-pound.
You're not trying to go to Disney?
Well, I wouldn't compare to.
We're going to Disney World. No? I think I'm funny. There's like a running joke. I remember when I first met Tim, he was like, or maybe I asked him, I was like, how would you describe me? And one of the words that he picked was fun. And I was like, what the fuck? I'm funny. And he was like,
you're fun. She doesn't like it.
It's my grumpy cat face.
This has been 14 years in the making. But yeah, I think that we have to look at, from whence it came, what happened, what set it up, right? So I do want to separate, like, injury from, like, a surgery that is coming off of an injury.
Yeah.
Like, it's a corrective surgery, as opposed to, like, something like a pregnancy where it's like a planned C-section, right?
Yeah. Or, I mean, sometimes they happen in an emergency, but that's a whole other topic.
But it's not necessarily like an injury that's leading to it. So from the standpoint of, like, pregnancy, like, what I wish, and we've talked about this before, I wish, pre and postpartum, there were so many more resources.
Yeah.
Because like it's such a trauma to the body.
And we just think it's like a normal thing because we've done it throughout life, but it is so traumatic. Giving birth is a traumatic experience. The amount of people who have died in that process.
Even before giving birth. Even before
just
labor.
Hosting a human in your body. Yeah. It's alien.
The number of changes that your body goes through. And it can be so challenging from a hormonal standpoint.
It's a beautiful trauma.
It's a beautiful trauma. Like at a physical level, at a mental level, at an emotional level, at a hormonal level. So there's just so many different things happening. And, maintaining normalcy is one of the big ones. So like if you are already active, you want to stay active for as long as you can.
Yeah.
And you want to almost like there's certain, things where you're going to, that are contraindicated. It's like, okay, we're not going to do that.
Yeah, there's certain modifications. And it makes sense based on where you're at, what trimester you're in. But if you're somebody who has already been active going into pregnancy, there's still so much you can do. Whereas
you should do.
Yeah. But like if you're somebody who's like, I'm pregnant now and now's the time to get active, it's not to say that you're not going to be able to make progress. But I would almost encourage any woman who is listening and you have a goal of getting pregnant, this like starting to lift, starting to get strong, starting to build muscle, getting ready for the event of a lifetime, which is giving birth. Fitness should be part of that strategy so that you have the most positive experience possible. And even if you do all of the right things, crazy things can happen, but the body will bounce back a lot quicker if we are training it to be strong and resilient.
Absolutely. And, like the nice thing about, if we're talking about pregnancy, it's not like, where you're going to carry can be a little different. Like some people it's higher, some people it's lower, but it's not like all of a sudden it's on like a hump on your back. Like we know exactly where it's going to be.
Yeah, we have an expectation, of pregnancy.
And we've never seen a dorsal pregnancy, right? So
anything can happen.
Well, probably not that one. Probably not. Don't say never. But because of that, we can almost expect the body's natural compensations.
Yeah, so there's going to be certain things. I do certain things when I happen to have a woman who's pregnant where I'm just like, we're putting this into your program to get you ready to, hold this huge person inside of your body and be ready to come back strong once you deliver baby.
Oh, but even like mitigating the risks that are associated with, there's so many risks. So like the big one, right? Like diastasis, where like the abdominal wall literally
splits,
bisects, right? So like we don't have to go out on a limb to expect that the abdomen is going to grow and expand as the baby grows, right? So we know that's going to happen. With that, there's also a center of mass shift, right? That's going to facilitate an anteriorly pelvic tilt. This is coinciding with, a hormonal release that's allowing for the tissues to become more elastic. And as that elastin is increased, and the pelvis is quite literally widening. And now all of a sudden it's like, oh, well, yeah, back pain just happens in pregnancy. It's like, no, we need to stop normalizing this. Like you can go through pregnancy and mitigate these things. Like it's not just like, oh, that sucks. Like deal with it.
I'm pregnant.
Well, and if there's something I can do, I want to do it. Right. Like that's how I am. If I can take an active approach, I want to take an active approach as opposed to a passive one. So too often in the medical community, we wait to treat. We don't work in prevention. Everything is, we'll wait till we'll see if it happens, then we'll treat it.
And such a shame.
But it's profitable. And that's the game.
That's one of the lenses we have to look at. This was like kind of a nightmare to hear. He was telling us some like really disturbing stories about some of the stuff that he's seen at the different hospitals that he's worked at over the years, where like doctors are, encouraging surgeries to happen, not because somebody actually needs a surgery, but because it's profitable for them. And unfortunately, and he was using the example of this elderly patient who, the doctor was like, you need to have this hip replacement surgery. I was like, this person definitely did not, like, the risk outweighed the reward, and the person ended up dying. Actually, there was another person, he said, that needed a hip replacement surgery, and the doctor ended up doing the wrong hip. And then they ended up going back in. That it's crazy to see that some people are just like so into it for the money, but that's the world that we live in.
Yeah. And that's the lens that I think people need to have the approach of just looking at, right? Understand that the way things are done might not necessarily be the best way. They're just the way it's been done. So it's getting perpetuated. So as it relates to like women planning to become pregnant, as it relates to like, you're not getting necessarily the care that you should pre and postnatal, whether it's pelvic floor physical therapy, like it's not something that's encouraged, let alone.
I'm totally going to jump in here. If this is the first time you are hearing the words pelvic floor physical therapy, go to season 1 of my podcast towards the end. Go look up the episodes with Dr. Amanda Olson. This information is about to rock your world. They are going to be linked at the end of this episode.
And I think that if people go in knowing I'm going to have this trauma occur in my body, and even though it's not, and that's the thing, it's not necessarily covered by insurance. It can be expensive.
It is in France.
There are limiting factors, and I understand that. And this is just the circumstances that are. But pelvic floor physical therapy can be so helpful.
Yeah.
To like, and a lot of times, like right now, it's all postnatal, but like even prenatal, it can be really helpful to like help cultivate a healthy awareness of how you're holding tension, because it is going to change and shift as your center of mass is moving, as this being is growing inside of you. But I would bring it back to my lens, right? It does alter the biomechanics. It alters how you move. The shape of your foot and where you're putting pressure in your foot tends to change as you progress through the stages of pregnancy. So all of these things can be foreseen and therefore prevented, as opposed to waiting to treat. But too often we wait to treat, and at that point you're already in pain. You're already not doing. You're already not. So like, because you're in pain, you're not moving. Because you're not moving, you're not like building strength. Because you're not building strength and you're not moving, you might even be losing strength. Now that you're losing strength, you have less resiliency. You have less capacity to overcome. You have less of a buffer zone should something, unfortunately go wrong, because like that is just the nature of it. If, the baby's upside down, for example, and now you need a C-section, like healthier tissues will respond better. They will adapt and be more resilient, and you'll recover better, period.
If anyone's thinking I'm about to get pregnant and I need somebody to like be with me on this journey, really doing all of this nitty gritty work, so I understand how to move better in the process, this might be your person. And if you're thinking to yourself like, wow, this is just so much information, there's no need to be overwhelmed with it. The message, the big takeaway right here is just try your best if you can. And I understand that every pregnancy is different, but if you have the ability to move and stay moving, it is going to be so helpful for you on this journey.
Yeah. And it's like, yeah, I don't want to scare. It's more to empower. Like you still have so much control over the situation because it is very foreseeable.
And I think sometimes there's like this misconception that like I'm pregnant, so I must be weak, or I like lost all of my strength. We have a friend who is pregnant right now. It's her third pregnancy, and she just PR'd a Turkish getup with a 24-kilo bell. And it's just like incredible. On both. Thank you. I know. She did it on both sides. And it's just so cool to see that like, just because you're in the season of life, it doesn't mean everything gets put on pause. I might not be encouraging her to continue to, can we, PR this even more, do more big things. But I think sometimes people think to themselves, I'm pregnant, so it's time to pause. And it's like, This is not the time to pause. If you have the energy, if you have the ability to continue to go, you want to take advantage of that momentum or that discipline.
Yeah. And I mean, in her case, because like, I'm going to blow up her spot a little bit because like I've known her I've known her longer than I've known you. But like, you know, she was having a tremendous amount of back pain. She was like, she wasn't training with kettlebells. She had in the past. And then she was, you know,
Rolling
training jujitsu. Yeah. And, you know, she was like, hurt my back and I can't walk and I have all this pain and blah, blah, blah. And like, I'm starting to feel better, but like, I need to do something. What do I do? And like, this was before she was pregnant, but she did tell me like, I'm going to be trying soon. So I was like, okay, you have to look at your goals. And like, this goes back to like, are you in alignment with, does your goal match up with the strategy to achieve that goal, match up with the circumstances by which you're actually going to make that goal happen? And it was like, there was just malalignment. So she's like, the doctor doesn't want me to, roll anymore. And like, but it's like my time to be social. I'm like, I get it. Doesn't mean you can't ever roll again. But if you do want to become pregnant, this might not be the time for that.
Yeah. Seasons. You can have seasons. It's okay.
So like, she had asked about one of the newer programs that you had just launched. And if I thought that
Rebel Bells,
would that be a good fit for her? And, we talked it through. I did a session with her just to kind of see like body-wise where she was at. And look at her now. Like, it wasn't that long ago that we had this conversation.
Yeah.
So it's just like.
And I think the other thing to just like kind of put out there, she's somebody who took the time to learn the language. She learned the alphabet. She learned the words. She learned how to make sentences. It's not like she just picked up a kettlebell and was like, look at me throwing 24 kilos over my head. Like she invested a lot of education in this.
But there's just so many things that, like, so many changes that the body goes through. So if you can foresee them, start managing those symptoms, you stop the chickens from laying eggs. I know I keep coming back to chickens and eggs, but like, last time we talked, chickens and eggs. I don't want to just treat the symptoms. I want to get at the cause. And with something like a pregnancy, the cause is there's a being growing inside you. We're not trying to treat that.
Yeah.
But it's the symptoms thereafter are very foreseeable, and we can stop them closer to their root, and then we can manage them. And I think that's the part, like, people don't like to hear that. So like, I'm going to have this. It's like, you're going to have to manage it.
Yeah.
While this thing is in there, he's not going to take a break.
I think sometimes people, they just don't want to have to do extra. And sometimes, if you want to keep the situation as calm as possible, there is going to be extra that you have to do. Otherwise, it might
not even be extra. It might just be reprioritizing. Like,
yeah, it's a shift.
Yeah.
It's just a shift in what you're giving attention to.
And that can go a long way. And with surgeries, like, the thing I'll say, like, because, talking about pregnancy, it's very like expected. We know what the body's going to be going through for the most part. But like with a surgery, like with an injury that says, okay, now you need a surgery. Let's say it's a back. Let's say it's an ACL. Let's say it's an Achilles, whatever. Something where there is like an ow moment that's now just like, okay, I'm in trouble. I need surgery. Very often, all of the PT thereafter is to help you recover from the surgery. Now, notice there was an injury that happened before that surgery. What are we doing to address that? And the answer is nothing. And that's very often the biggest problem, is that we are treating the surgery. Great. What put us in this situation in the first place? Was it a mechanical setup, or was it a tissue imbalance? So like, again, I don't just want to treat the symptoms that occur thereafter the surgery. I want to look at like, well, what caused the injury in the first place? Was it a movement patterning thing? Because we're nothing if not the product of our own repeated and chronic and like continuously done actions. So we want to zoom out. We want to look at it from the big picture lens. And if we can, we tend to have more profound results because we're not just like cutting the heads off weeds. We're getting at the root system and changing it from the inside out, from the ground up.
And I think for a lot of people, they don't necessarily think that they're doing anything wrong until it necessarily gets pointed out to them.
Well, what do you mean when you say that? Like when I'm doing something wrong?
Well, I think there's a lot of people who are just like, I want to do the workout. I want to, get the sweat. I want to, increase the weight. And it's like, well, sometimes you're like running before you're ready. You're running and you haven't even figured out how to walk.
Sometimes haven't even figured out how to crawl. So pretty recently, new person, like I have chronic back pain. My back always hurts. And like, I don't want to stop training. That's what she said to me. I was like, okay, I get that. But let's see if there's something in your training, the good things that you're doing that are just having the wrong reaction. And if there's anything we can tweak. Now, sometimes there's mobility concerns. Sometimes there's stability concerns. Sometimes it's just a matter of I didn't understand the intention of the movement. And therefore, I thought I was doing it right. And I thought the sensation and the feeling I was getting in my body was correct.
I say that all the time with kettlebells. Totally going to call out like a kettlebell swing. You're supposed to lift the bell with your hips, not with your arms. And I see a lot of people and they swing this kettlebell lifting it like a front raise. And then things just get kind of confusing and murky when it's like, we now need to rewire what you've been doing because you didn't understand the assignment.
Yeah, at a fundamental level, you didn't, and it's not necessarily your fault because once again, if we're looking at like the textbook of an exercise, right? And we see a big,
it's like I can understand why you thought
frame,
that.
Last frame, we see the position, but not necessarily how we move through it. And even if we're watching someone, right? Like we're watching someone live and like monkey see, monkey do, but we're still just trying to mimic. We might not understand the fundamental foundational purpose of, where you're driving from, where you're creating from. And so in this case with this woman, it was a deadlift, and a deadlift is a human pattern. It's like beyond exercise, right? Like it is
picking up the laundry. It's picking up the
pencil
groceries
from the floor.
Yeah.
Like and not saying it needs to be like super rigid, but like the hinge pattern.
It's normal. We all do it.
We all do it. Now, a healthy spine, yes, it should be able to, flex and rotate and even do some of that together. Now, how much? There's going to be a law of diminishing return of how much you want to be doing that, especially loaded and especially with increased load. But I take one look at a body weight hinge pattern and I was like, okay, I want you to, like, I bet you feel your back right now as you're doing this. You're like, okay, I want you to tweak these couple little things. And it's just, joint angle modifications, right? So it's like, okay, you are really, really tall through the hip, very straight through the knee, and very, bent. Your head is below your hips, right? So your shoulders are below your hips.
Pop quiz, how do we set up for a hip hinge? Shoulders higher than hips higher than knees.
So just seeing that, I was like, okay, let's try this position instead and go through this pattern. How does this feel? I feel my hamstrings. I feel my glutes. How's your back feel? I forgot. So once again, we're not talking about chronic back pain. I always feel it. Were her words. Always feel it. And like, this is a woman who moves well, has good mobility, good stability, just lacked a foundational understanding of what the movement was intended to do. And this is why, like, we need to, and well, so what do you do when you feel this pain? Oh, I just, kind of power through. Please listen to these signals.
Is there ever a time in your book to push through pain?
You have to have a very good understanding of what the type of pain. Because sometimes, so like, okay, let's say a muscle pull, right? So let's take a groin strain because they can be a little complicated, right? So if we have someone who has a groin strain, the natural tendency is like, I want to rest. I'm going to do nothing. And it's like, well, that's not it either, Chief, because what's going to happen is your tissues identify that there's weakness. When there's weakness and instability, it says, let's create stability. So then, and we like often see this as like, oh, scar tissue. Well, where did that come from? Because your body was in a rush to heal itself. So it just starts laying down fascia, right? It starts rebuilding, and it's a matrix of just like pickup sticks. It's a mess. There's no orientation. There's no structure. Now, once upon a time, that tissue did have structure. It did have a pennation and a fiber orientation. And now all of a sudden, it's just in a rush to get back to being whole. So what I call a healing stress, the way in which we want to teach that tissue to recover, we need to stretch it along that line to encourage it like, hey, lay the pickup sticks, not here, but right here. And if we stretch along that axis, we can incorporate that. If we move along the lines and the angles that the tissue is designed to move, and this is in reference to, the mechanism that caused the injury in the first place. So, what was the traumatic moment? What were you doing? Like, oh, it was a cut. Like I did a drop step and my groin just popped, right? So I'd want to go to something that looks like that trauma and teach it, this is how I want you to move. Now, it might not be the most comfortable thing.
Yeah. Kind of scary.
And you have to start slow. You have to start small. You have to build upon the success. Because even take something like a car accident, like a whiplash scenario, right? So what's happening is my body is held back by the seatbelt, right? But my head is going through this big whip, right? So all along the back line of my body, literally from like my forehead up through back of my head, back of my neck, down my spine, through my sacrum, down my hamstrings, through my calves, to the bottoms of my feet. That whole line is connected, that whole line of fascia. So all of that upon that stimulus is saying like brake force, stop, seize. So after a trauma like that, anything that looks like that, even slow speed, is terrifying.
Yeah.
Because it alerts that same system, grab. So we have like really stiff necks. So what we'd want to encourage, and once again, after clearing and making sure there's nothing else, like, there's nothing broken, they're like, okay, it's just, whiplash, you're fine. It'll be a couple days. Like, you can accelerate that by reteaching the tissues. Now, what do I mean by reteaching the tissue? So if we have like a literal, like there are muscle cells that are broken. We have a grade 1, grade 2 strain of the tissue, and we're trying to teach it how we want it to load and unload again. We can do that. And we do that by teaching it based on its form, its function. This is what you do in this situation. So we're reteaching it in an authentic environment that's relative to how it happened. And this helps the body figure out how it should recover. So that not only speeds up the recovery process, but it also prevents unwanted like problems down the line because it's not compensating, it's healing. So what that feels like, it might not feel comfortable, but like, something that's like, oh, sharp, that's not good. We don't want that. But it's like, I feel it here. And it's like maybe a little strained. Okay, back off. How does it feel here? Find your success
and start working
outside of that. So with the example of the whiplash, the first thing I want to do is actually like, okay, well, where in this chain can we start creating a very slow speed flexion that starts to simulate the trauma? So the body identifies like, okay, even though this line was traumatized, this movement isn't scary when it's slow. Okay, so then, when it's slow and when it's contained. So now it's slow, it's contained. Well, what happens if we move a little bit more? Is it still okay? Very often we can just encourage the body's natural defense mechanisms to inhibit, to reduce, to calm down. And this is like, it's a guarding. Your body, your central nervous system is just like, that hurt. Let's never do that again.
Totally. And we see that in like other areas of life. Like I remember I grew up riding horses, and I remember being thrown off the horse. It was so important. My instructor was like, you need to get back on this horse, because if you don't, the fear could end up paralyzing you from, moving forward with this thing. And it's interesting how with the body, it's the same. you can't just avoid the scary situation. You have to reintroduce that. It's okay.
But that's the important part. It needs to be done.
A reintroduction.
It's from
Is that what you're going to say?
up, like super slow. Yeah. We need to reintroduce the tissue to this is who you are. This is your job. Here are your friends. You are safe. That's the biggest thing. Because like if the tissue doesn't feel safe, like I like to think muscles are like people. Muscles are very much like people. If you have a tissue that is traumatized and you throw it into a big social setting where it's now on stage needing to perform, it's not going to respond well. But if you show it how many friends it has, show it its support system, show it who it's connected to, how it's supposed to work in function, in relationship, everything's relational, right? So if you teach that, now all of a sudden the tissue doesn't feel so scared and they're willing to go out. We're not putting them on stage and shining a spotlight on them, but we do want to reintegrate them. And it's through that reintegration that healing actually occurs, because healing doesn't occur in a bubble and translate well to real life. It needs to have this gradual growth and development, because very often, and we see this a lot in rehabilitative settings, where a guy takes someone with a hamstring injury and they're like, great, we've recovered from this. You can do a single leg glute bridge now. You're super strong and you're really well connected. And we can do this hamstring curl on the machine. You're really strong. And then the moment that same person goes to take a step down a curb or, for example, something like that, and they have to decelerate, and they're like, well, I haven't done this yet. What the hell is that? And now it's re-triggered. It's re-traumatized. So like there's a gap that exists between the muscle is strong in this setting,
but
and
not
the muscle
authentic
is
to
authentic and resilient and like has the ability to react.
Can we just like take a moment to shout out what it is to train functionally? Because something that I'm noticing more in social media is people are just like, functional training was like bogus, or just like, this thing that we did, but other forms of training are better. And it's not to say that one is better than the other, but, if we are trying to be functional for life, we are trying to use exercise as ways to better ourselves, to go about life. It's really important that you are doing things that are authentic to life.
So with functional training, right? Because like define functional.
It's functional for different people's lives. Like I've seen some crazy workouts, and like maybe it's because like this person is, a breakdance fighter, or they're a luger. Wait, what do you call a luger? Like they do, like they're that one who luges. Luger.
I'm sure there's a name for it. I don't know what it is. But the same way when people are like, I want to be strong. Well, what does that mean to you?
Yeah.
Because
you get to define it. Yeah. It's an umbrella term.
If someone says like functional training is bogus, define functional training. Because like I might actually be inclined to agree with you. Because if you think functional training is
bodybuilder,
like people who are like,
no, I'm saying like I've been seeing that in more of that community.
Yeah, they're looking at functional training saying like it's bogus. So, but what does functional training look like to you? Because if they're going to say like functional training is when someone is standing on one foot on a Bosu ball and their other foot's on a slider and their one hand's doing a dumbbell curl and their other hand is using a body blade and wiggling that around, I'd be like, yeah, that's probably a pretty ridiculous thing to be doing. What does this translate to? What are you doing this for? Now, of course, there are very specific adaptations for imposed demands. If you are trying to create an environment that is very relatable and very situational for you, by all means, it is functional. Functional is relative to the tasks. So, for example, like take a fencer.
Yeah.
A fencer, what their sport requires is very different because it's so unilateral.
Yeah.
Is so different from, let's say, a golfer, which is so different from, let's say, a hockey player, which is so different from someone who just wants to be able to bend over and tie their shoes. You know what I mean?
Yeah.
So like
it's on a spectrum, the concept of functionality.
And yes and no, and this is like the caveat. So when we say functional training is relative, that part, yes, I agree. Functional training needs to be relative. It needs to be specific to and relative to the task. Now, functional training as it relates to how the body was designed to move and the relationships it is connected with and the language with which it speaks, that isn't really relative. That is. And what I mean by that is like, I have a posterior chain, you have a posterior chain. I have an anterior chain, you have an anterior chain. I can move in the frontal plane, you can move in the frontal plane. I can rotate, you can rotate. There's a lot of similarities there.
Sure.
So if we look at functional training as it relates to, and it's relative to the body and how it was designed, now all of a sudden, yeah, I'm interested in what you call functional training. Because if you are training it three-dimensionally and you're training it between gravity and ground reaction forces, it's probably very translatable to just about anything you would ask the body to do. And therefore, it is functional relative to long-term athletic development, period. And that goes for everyone. I call that movement literacy. So if someone's like, oh, functional training is bogus, I'm like,
there's nuance
let's
to
talk
it.
about
Yeah,
what
let's
that
have a
means to you.
conversation.
Because usually what they have in their head when they say that, I agree with, is someone standing with 1 foot on a Bosu ball, 1 foot on a slider, one hand on a, I don't know, like
a blade, a body
blade, and then
shake
one
weight.
hand on a shake weight. Yeah.
I'm
let's
not
get a
going to do
shake
that one.
weight.
Are you going to do it?
Do it?
Do it. We know the memes we're going to be set up for in that case.
No, we've not. This is a video pod. This is a family friendly.
No, it's not.
Well, we don't need to go to that degree. We have a PG-13 rating.
We say cock and fuck a fair amount.
We don't need the visuals of the shake weight. Oh man,
you can visualize
God
it.
bless the shake weight.
I
What a
have South
meme.
Park in my head.
Yeah, that's a good thing to have in your head. It's a good thing to have in your head. Anyway, I would say not very translatable, not very functional, not very,
I mean, a shake weight can be
very functional depending on a very singular task.
Yeah.
Thank you, shake weight. You're ridiculous.
Okay, getting back to topic.
The shake weight is the best fitness.
We are not promoting shake weight. You want to strengthen that, go do it in real life.
Specific adaptations for imposed demands. Be specific. Just do it.
Okay, Tim, do you have any final thoughts before we wrap up this episode?
I think we got to end on the shake weight. I think that's
it's
final thought. It's a finishing thought, some might say.
Oh, what a happy ending.
Oh no. That was funny. Normally I say that you're fun. That was funny. High five.
I think the best way to wrap this up is just understand that muscle strength, it is a currency. And if you are somebody who plans to go through a period of life knowing that life is going to happen and maybe you're going to birth a child, or maybe there's a surgery planned or unexpected, if you can start to develop the habit of strength training, you are going to set yourself up for success.
You'll be equipped for life. You'll be ready for whatever life throws at you. That too. Yep, that too.
Thanks for tuning into this episode. Make sure to give us a rating and review, and I hope you listen to the next one.